introduce my PhD thesis titled The Association Between Fluid Therapy and Organ Dysfunction in Critically Ill Patients. My name is Ildikó Szántó. I'm a first-year PhD student and an anesthesiologist and intensivist in Nyíregyháza. I have a personal vision in my work to use everyday clinical practice, science-based fluid therapy to improve organ functions. And to achieve this, my mission is to optimize therapies for critically ill patients through tailored fluid strategies. At the moment, we have two ongoing projects with similar topic. We would like to investigating the effects of balanced crystalloids versus isotonic saline and organ dysfunction in patients undergoing major surgery and in septic shock. Let's see the common background of these topics. Fluid administration is essential in hemodynamic stabilization, for which the first choice is the crystalloid solutions. There are two main types of crystalloid solutions, the balanced and the unbalanced solutions like isotonic saline. The problem is that the concentration of chloride of the unbalanced solution is about 50% higher than the concentration of chloride of balanced solutions or the blood. And this excessive chloride intake can be harmful for the patients, causing metabolic acidosis or arrhythmias. Let's see the first topic, which is investigating the effects of balanced crystalloids versus isotonic saline and organ dysfunction in patients undergoing major surgery, which is a systematic review and meta-analysis. The problem is that there are more than 230 million surgeries per year, which is associated with a relatively high complication rate. It is maintained normal volemia during the surgery because both hyper and hypervolemia can lead to organ damage. And we know that the fluid administration is essential in the perioperative phase. And there are some guidelines which suggest using crystalloids as the first choice. But what we know, we don't know that we don't have enough evidence whether balanced or unbalanced solutions are associated with better clinical outcomes. That's why our aim is to investigate the effects of balanced solutions versus isotonic saline on postoperative complications in major surgery. Our clinical question is is perioperative fluid therapy with balanced electrolyte solutions more beneficial than isotonic saline in preventing postoperative complications, where our primary outcome is postoperative complication rate based on the Schwarzwälder article. We have done the systematic search on the end of the last year with the search key, and then the end of the selection process, we ended up 29 full-text eligible articles. We have finished the analysis for postoperative complications and most of the secondary outcomes, but there are some ongoing analysis, as you can see on the slide. The first result which I'd like to show you is the postoperative complication rate. On the slide you can see 7 articles. Those are all of them RCTs. The between study heterogeneity is low, and overall risk ratio is 0.86, which is statistically and clinically significant. On the next slide, you can see the intraoperative chloride level changing between the two investigated groups, where you can see 15 RCTs with almost 9,000 patients. And you can see that the chloride level is about 66 millimole per liter higher in the saline group, which is clinically and statistically significant. And on this slide, you can see a subgroup analysis, patients undergoing renal transplantation. And in this group, this result is more pronounced. And to emphasize this, we have the result from the difference with the intraoperative pH level in the two groups, where you can see almost 800 patients from 14 RCTs, and the overall mean difference is 0.053. And to emphasize this result, we have done another investigation. You can see two slides or two pictures on the slide. On the left side, you can see the intraoperative shifts in pH values, where you can see that the isotonic saline group is the changes are more pronounced than in the balanced electrolyte solution group. And the other side of the picture, you can see the degree changes in the pH level, where you can see hardly any change in the pH changes in the balanced electrolyte solution group, while in the isotonic saline group, the results are well below the 0 line. And these results are associated with the fluid-infused amount, these groups, and we have this result that in the two groups there is only 50 milliliter difference, which can explain that there is a little changes in the pH or the chloride level in these groups. Our strengths are that we can use only with randomized control trials, and we can calculate high number of patients, but also we have limitations that we have different study types and very high heterogeneity of the population. We can conduct it that the balanced crystalloids can reduce postoperative cardiovascular complications, and for that our implication for practice is that using balanced electrolyte solutions can be the first choice, especially in high cardiovascular risk patients. And our implication for research is that we need further studies with homogeneous population to provide better evidence. Our first project in progress parallelly the risk of bias assessment degrade, and we are in the stage of manuscript writing. And let's look briefly at our second project, which will be also systematic review and meta-analysis. In this case, we would like to investigate the septic shock patients. Sepsis or septic shock is a relatively high disease in intensive care units, and the problem is that despite the improvement of the healthcare, the mortality rate remained very high, and we have a weak evidence level from surviving sepsis guideline for using balanced electrolyte solutions. And the missing link is also that we don't have sufficient evidence that how fluid type influences organ dysfunction. That's why our aim to investigate how balanced crystalloids versus isotonic saline affect organ dysfunction in septic shock patients. Our clinical question in this case, does using balanced crystalloids decrease organ dysfunction compared to isotonic saline? We use the PICO framework where our patients are septic shock patients. We compare balanced crystalloids with isotonic saline, and our primary outcome will be the SOFA score. And we hypothesize that using balanced crystalloids is superior to isotonic saline and is associated with organ dysfunction in septic shock patients. And our clinical implication would be that using the most appropriate fluid can decrease the incidence of organ dysfunction and lead to better outcomes. So summary my aims, I would like to submit my first paper in October and the second at the end of this year. And I would like to thank for your attention with the quotes of Master Yoda, the greatest teacher is a failure. Thank you for your attention.
Thanks for the presentation, and I wonder how many in the audience know who Master Yoda is. We with the gray hair we usually know. Any questions? No. I have a couple. For the first one, were there any differences, or can you control for acute versus elective surgery? Because that can play a role.
It was together. So there was articles where were only elective surgeries, where there was were acute surgeries, and there were some articles where both together.
So would it make sense to analyze those separately?
No, because the results wasn't reported in this site.
So it's impossible.
Yes.
I still think it would be relevant.
Yes.
Then the second one, can you in any way adjust for the cardiac function that may play a role?
Of course, but unfortunately these studies didn't make measures. There are some articles where in the baseline characteristics you can see that how was the ejection fraction before the surgery, but this is the most information we can get from the patients, and in the results part also we cannot differentiate that the results, how many % of the patients had worse ejection fraction, for example.
And ejection fraction doesn't tell you anything.
Yeah, of course, but this was the only cardiac information.
Yeah, okay, I understand. I'm just trying to see whether more is possible. And for the second one, maybe also relevant for the first one, I think that we should compare different strategies once we have reached the therapeutic goal, and that is the organ perfusion in our patients. Actually, can we do that? We also know that Fenice showed that we don't care about the organ perfusion, basically. We do many worrisome things. So is there a way that we actually would compare different strategies of fluid support once we have reached what we should reach with fluid resuscitation, that is the organ perfusion?
There are some measurement, like, if I understand well your question, like central venous pressure measuring or lactate level, we can measure these parameters, but altogether they can show some picture about the perfusion, but there, I think there is no only one parameter which can show us directly how is the perfusion is.